Is your fruit snack a secret to gentler blood clot busting? This week, we're beginning to explore powerhouse foods that might have the potential to change your life. Normally used to stop bleeding, blood clots can become dangerous in some cases and possibly lead to heart attacks and strokes. In order to keep oneself healthy, it is very essential to know this disease and how we can manage it. Join us next as we look at how your diet, especially fruit consumption, contributes to keeping blood clots under control. This video explains the evidence as to how some fruits literally prevent or even reverse blood clot formation, using research and clinical trials that are very well established. You will learn not only about the power of these fruits, but also how they work with your body's natural forces to enhance the health of your vascular system. In addition, adding these fruits to your regular diet seems to be a fun way of boosting heart health as well. The best way to be informed is not only through theory, but also with some practical tips and tricks on the part of each fruit, which will help you get through any diet. This video is perfect for health nuts, as well as for anyone who wants to make small, powerful changes that might even save your life. But first, a quick reminder: all content is for informational purposes only and should not be construed as medical advice. Always speak to a healthcare professional before introducing changes to your diet or lifestyle, as some health circumstances and drug interactions could be impacted. Blood clots are gel-like masses made up of platelets and fibrin in the bloodstream that stop bleeding. Unfortunately, as necessary as they are for the healing process, these clots can turn deadly if they form in larger arteries or veins, causing issues such as deep vein thrombosis or pulmonary embolisms. Having enough of the proper nutrients can greatly reduce or even prevent bad clots from forming. The balance between clot formation and disintegration is essential for maintaining vascular health. When this equilibrium is lost, it raises the danger of a few clot-related consequences. In today's video, we are going to discuss how some of the nutrition from fruits can help regulate clot formation that happens inside our bodies, and all you need to know about it. We will also take a look at how the antioxidants in foods, such as fruits, are capable of decreasing inflammation and thereby inhibiting clot formation. In addition to reducing inflammation and relieving the risk of clots, these fruits can aid in keeping your heart healthy overall. This video will culminate in a discussion of the relationship between diet, inflammation, and coagulation to give you a bigger picture of how some simple dietary choices can have exponential impacts on health. Top 7 fruits to eliminate blood clots. You can also include fruits if you want to prevent blood clots. Here is how these 7 fruits fared. 1. Avocado. A powerful antioxidant, avocados are packed with vitamin EA, which helps reduce the risk of blood platelets clumping together, one of the first steps in forming a clot. In addition to vitamin EE, avocados contain rich stores of monounsaturated fats, which can help lower bad LDL cholesterol levels and soothe inflammation across the board. Such a thing is especially advantageous for cardiovascular health and reduces the perils of clot formation. Plus, avocados are packed with fiber, which can aid in blood sugar control by slowing down digestion and thus helping prevent dangerous blood sugar spikes. Elevated blood sugar promotes clot formation. As a result, by adding avocados to your menu, you could be covering multiple bases at the same time, not just for vascular health, but metabolic stability as well. 2. Pineapple. Pineapple contains enzymes called bromelain, which are more effective in dissolving blood clots and thinning the blood. The bromelain in pineapple works to neutralize the pathways of clot formation in the blood and cuts down on the presence of circulating levels that can aid the proliferation of existing clots, while also helping to prevent new ones from forming. As such, pineapple can serve an important role in a heart-healthy diet. Beyond that, pineapple is also a fantastic source of vitamin C and manganese, both strong antioxidants necessary for neutralizing the free radicals in your body to keep your cells safe from damage and supporting collagen production, an important protein that keeps your blood vessels healthy. This nutrient combination supports the health of blood vessel structure and decreases the likelihood of matrix metalloproteinase, MMP activity, causing conditions that would allow clot formation to occur. Incorporating pineapple into your diet may hence be a delicious and beneficial practice for improving heart health. 3. Kiwi. Kiwi is chock full of antioxidants, which can reduce blood clot formation and contribute to a healthy vascular system. This fruit is very high in the critical vitamin K that regulates blood clotting processes naturally. Kiwi may help create the fragility needed for blood to congeal without sticking too much and clogging up the bloodstream. Some components also serve as mood and cardiovascular enhancers, like serotonin and folate found in kiwi. Increasing serotonin will improve sleep and reduce stress properties. And if your heart is working better, it will help prevent the likelihood of abnormal clot formation. Kiwi is even a holistic choice that can take heart health to the next level in terms of well-being. 4. Pomegranate. Rich in antioxidants, pomegranate can decrease blood pressure and lower plaque buildup in the arteries, reducing the risk of clots. Pomegranate is also rich in punicalagin and punic acid, two powerful compounds that help boost its cardiovascular health benefits. These compounds improve endothelial function, which is the thin layer of cells lining our blood vessels that send signals to help with dilation and constriction to promote good blood flow. They may also decrease arterial stiffness, which is a precursor to clot formation. On top of that, regular intake of pomegranate juice has been shown to increase nitric oxide blood levels, which helps make the blood vessels open wider and prevent dangerous clots from forming. This, along with its anti-inflammatory effects, places pomegranate as an important dietary agent that can be used to combat atherosclerosis and other vascular diseases and their complications. 5. Grapefruit. Salicylic acid in grapefruit acts much like aspirin to thin the blood and prevent clots. Grapefruits are also packed with flavonoids, one in particular being naringenin, known for its anti-inflammatory effects that help protect your blood vessels from damage and support overall improved circulation. These benefits illustrate why grapefruit should be part of any heart health optimizing diet. Besides its blood-thinning effects, grapefruit is also a cholesterol-lowering fruit because it contains a good amount of pectin, a type of soluble fiber that binds fats and cholesterol present in the gut, favoring their elimination. Both of these effects, cholesterol lowering and blood thinning, result in more complete cardiovascular benefits, making grapefruit an excellent dietary choice for individuals who want to keep their heart working smoothly but naturally. 6. Oranges. Oranges contain flavonoids that are good for blood flow and prevent your blood from becoming too thick and easily clotting. The high vitamin C content in oranges is important for collagen, which helps maintain the good health of blood vessels. This nutrient helps to keep the arteries strong and flexible, preventing blockage that can cause blood clots to form. Additionally, oranges contain hesperidin, a compound that has been shown to improve blood vessel function and reduce blood pressure by helping keep blood pressure in check and promoting proper vascular function. Thus, oranges reduce the potential for clot formation, offering a natural path to heart-healthy living. 7. Berries. Berries are classified as superfoods because they contain a lot of polyphenols that help with inflammation and cholesterol, which can prevent blood clots. They are also a high salicylate food, similar to aspirin, which adds to their blood-thinning effects. One of the best things you can do to promote good circulation is to incorporate a daily blend of berries in your diet, such as strawberries, blueberries, and blackberries. Beyond their clot-busting capabilities, berries improve heart health by enhancing cholesterol levels and decreasing oxidative stress and arterial stiffness. This overall cardiovascular protection makes berries an essential component of any diet designed to decrease the likelihood of thrombosis or other related conditions. Blood clots can be a tricky subject with many questions. Some of the most common concerns and answers include: what should I not do if I have a blood clot? Avoid inactivity for extended amounts of time and ask your doctor for more specific dietary or lifestyle changes. In addition, smoking and alcohol should be limited or avoided, as these factors increase the risk of blood clots by thickening the blood and narrowing the blood vessels. Activities that get the blood circulating help prevent clots, and managing medications and supplements in a decent way under medical guidance are some steps one can take to manage the risk of clotting better. Does walking prevent blood clots? Absolutely. Walking is one of the best ways to get your circulation moving and stop clots from forming. For example, walking helps provide blood to your legs and feet when you are sitting immobile for a long time, such as on an airplane, thus reducing the risk of deep vein thrombosis, DVT. This low-intensity exercise can greatly lessen the chance of clot complications by promoting blood flow through veins and stopping them from building clots due to inactivity. What occurs when you get a blood clot? If a blood clot travels to a less dangerous place in the body, the symptoms may be nothing more than some swelling, pain, and discoloration on the other side of the body. However, if it reaches an important organ, such as the lungs, heart, or brain, it can be a serious condition. A pulmonary embolism, heart attack, or stroke can occur, with symptoms such as sudden shortness of breath, chest pain, or new onset confusion, indicating that a clot has moved to an area where it can cause harm. Immediate attention is needed. Can a blood clot dissolve on its own? Although some clots may naturally dissolve, often medical intervention is needed to prevent complications. Superficial veins, especially in the lower extremities, may have your body's natural anticoagulant mechanisms sufficient to break down clots, recognized as non-dangerous. However, in the case of more serious or life-threatening clots, such as those located deep within your veins and arteries, doctors usually prescribe drugs like anticoagulants, which actively break down the clot and help prevent future blood clots from forming. How long can you live after a blood clot? Survival and outcomes depend on where the clot is located, how big it is, and your general health status. Treatment should not be delayed. Earlier diagnosis and treatment will greatly reduce mortality rates and the risk of complications. For example, if a clot in your leg is small and deep vein thrombosis, DVT is just starting. Exercise and fluids may treat that small clot, maintaining it where it is without moving to the lungs. Pulmonary embolism. Early prevention, control, regular compliance with prescriptions, and regular medication checks can be vital and effective measures for managing blood clotting and improving patient outcomes. Like the video if you found it helpful, subscribe to this channel, and hit the bell icon so that you never miss a future update. Share your comments on what your thoughts are, because every little bit of engagement helps us keep bringing life-saving content to you.